as a medical doctor for a couple of decades now, I have come to the conclusion that we are messing around with medicine. I don't know when it started, but it is happening right now. You all have in mind the scenario that is few thousand years old. The person who is suffering from illness goes to knowledgeable professional, in earlier days shaman or healer, nowadays it's medical doctor, gets advice, and we presume that he or she is following the advice. Does it happen in real life? Do you follow? Do you listen to the things your doctor says? Or you listen to your relatives and friends? I have learned the different thing. And I have learned it in my professional life. Recently, I had a lady with a high blood pressure. We did all investigations, and it was clear that she has no serious underlying disease. I prescribed medicine according to latest guidelines and evidence-based medicine. We agreed that she might change some habits in her life. And after that, we agreed that she will come back after months for follow-up consultation. She appeared earlier. And she appeared with a high blood pressure and swollen ankles. I was really puzzled. What's going on? Why it has happened? I gave the pharmaceutical medicines according to latest guidelines. She did all investigations needed. I was all ready, to start a new round of examinations. But then the lady told me the real story. During the consultation, she asked me for how long she will have to take medicine. And I said, that's a lifelong treatment because you have a chronic disease. She was very unhappy. She decided to change some habits in her daily life and did not start medicine. But while traveling to countryside together with her friend, she had very high blood pressure but didn't have the medicine with her. The friend, who also had to take medicine to lower the blood pressure, gave some tablets to my patient. But after using the different tablet for 5 days, she had the swollen ankles. And that was the moment she came to me. And I understood that the problem was not the wrong diagnosis or incorrect prescription. The problem was misunderstanding and incorrect use of medicine. I'm always have been thinking, this is just my problem. Is it happening only to me, or it happens in healthcare? And I have found out that it happens. It happens in countries where there are very limited resources for healthcare, as you can see, and very limited possibilities to treat people. It also happens in countries with very sophisticated healthcare systems. The problem is how we communicate, how we understand each other. Unfortunately, quite often, we have one conversation and different understanding. The patients after such consultation quite often feel puzzled, headed, misunderstood, and sometimes even miserable. Have you felt like this? I have. What could we do? I was trying to search what is the situation in the world, and I found out that the research on adherence to medical treatment says different things. Some say that only 50% of patients are following medical treatment. Some say that only 38% are following medical treatment. But I found out that the big meta-analysis done on and published in 2004 that collected information from 1948 till 1999 and included 569 studies reporting adherence to treatment by prescribers, non-psychiatric prescribers, and 164 studies that even gave some correlation between age, patient gender, socioeconomic status. This big analysis said that in average, 24.8% of patients are not following the advice given by doctors. That means that out of 100, 25% of patients are not following the advice of doctors. What does it mean? Is it just messing around with medicine, or it's messing around with money? Do you know how much money we spend on this planet on healthcare every year? It's 6.5 trillion US dollars. And if only the fifth part of this money is wasted, it means that we are wasting amount of money which is comparable to the GDP of France and Germany. Okay, you can say you cannot make this assumption, but if I only take the worldwide spending on pharmaceuticals, and global pharmaceutical market is 300 billion US dollars a year, according to the World Health Organization data, we are wasting every year the money we could use for research. The research budget of this planet is about 1 billion US dollars, and we could spend this money for space exploration. Why it is happening and what can be done? The researchers in healthcare and organizers of healthcare almost 20 years ago sparked with an idea about patient empowerment. You already heard today the story about empowerment and what does it mean. Empowerment means that patients are expected to take control of their illness and treatment, and medical doctors are expected to encourage or empower them to do so. Is it feasible? Can you drive a car if you do not know how to do that? Or you will ask someone who knows how to bring you from the point A to point B. Are really patients willing to take control and make choices about their own treatment? The research done in 1991 and after 10 years in 2001 says that not always, especially when there are very serious cases. You have to know to take a power, you have to know why and what is happening with you. But I don't think the biggest problem is patient. The biggest problem and the person who really messes around is the medical doctor. Even in this century, we still have this black box or bio-robot approach to the patient. The patient is like a black box with symptoms. There are symptoms, medicine to suppress symptoms. Symptoms, medicine to suppress symptoms. We have forgotten what the founder of Western medicine, Hippocrates, believed. He believed that pathological symptoms and disease is a way how the human body regains back its health. He believed that for good health and regaining health, we need clear, fresh air, good diet, appropriate exercises, and cleanliness. After 2,500 years, we are at the same point. We are learning that those are the most important things in human's life. Those are most important things to maintain our health. I wouldn't like to say that medicines are useless. We do need them. They are very important. There's a research going on. We hope that stem cells and new medicine and maybe areas of medicine we do not know yet will help to be healthier and to live our lives happier. But there's a question, what can we do? How long we are going to mess around with medicine and how long we are going to waste money? I would say that there are a few things we can do. The first thing, we have to build partnership. The medical treatment is a partnership, and the first partner is every one of us, ourselves. We have to know about our bodies, and we have to learn it in school. Not only history, letters, ciphers. How much do you know about your body? Do you know where is your heart? Do you know where are your bowels? Do you know where is your stomach? Who knows where is your stomach? Can you show on your body? I hope that more and more people will know not only about the structure of body, but at least the basic things about function. Because only that will help us to take power and take control over disease and treatment. The second partner that really should change and should learn is medical doctor and other health professionals. We have to learn how to communicate and tell people about chronic diseases, about lifelong treatment. Otherwise, we both will feel miserable and misunderstood. And research in medicine shouldn't be just revealing of new medicines and treatment methods. We have to learn how to change our daily habits, how to make our daily life healthier. Then we will have one conversation and one understanding, and medical treatment will become equal cooperation of two partners. Thank you.